the difficulty is some people do take a long time to respond with antibiotics, and other people, the antibiotics aren't helping them. And it's a real, I mean, and this is the art, and something I know that you pay a lot of attention to, and we as a clinic, making sure that we're not continuing to treat when the Lyme is gone. And so how do you, I mean, which I said, this is a big problem for those people who are ill to understand, is that the symptoms don't always go away. So how do you parse that? How do you look at those people?
Yeah, absolutely. And I try to tell them too. I mean, there is probably such an entity as post-treatment Lyme disease. We can't always assume that it's just, the bugs are still there all the time, especially if they've been through, nuke the earth kind of treatments out there, which some patients do come in that have like 4, 5, 6, 7, 8 antibiotics or more. And you have to wonder if it's surviving through that. So new testing, I think, is going to help guide this process. I also have to parcel out the symptoms too, because a lot of times there is an immense amount of lingering autonomic dysregulation. Like I was just talking to Eric about my uncle who had, hospitalized with Lyme 3 years ago, and he still has dysautonomic issues of elevated heart rate, and then goes low heart rate, up, down, and all around and everything. And so theoretically, they gave him enough IV antibiotics that he didn't have anything left there anymore. But the new testing in question that we use, the one I'm very excited about is brand new pretty much, and that's the culture, the amplified culture through IGeneX, where they take a blood sample, they put it in a proprietary medium that mimics human whatever bioactivity or whatever, and then they do a PCR or DNA arrangement on it. And so they're finding things as a direct test to try to reevaluate the presence of these things. So if there's really not a lot of DNA, we really can't always assume that we can sterilize a system 100% in a chronic infection. However, we can certainly marginalize the heck out of it into a place where it's really not doing too much. So you would hope that the PCR testing shouldn't really pick it up to a large degree, because there's not going to be a lot in the blood anyway with some of the creatures like Lyme, Borrelia burgdorferi and friends, because they don't live there all the time. But if you killed a whole bunch of it and you've given it time to try to recover, and then you've drawn the blood and then amplified the sample and it's not there, hopefully that means that it's not there. That's one thing. The other thing is that if you're looking at the immune system, I personally feel, and a lot of people agree with me, I think that the serology or the antibody testing isn't always the best way to really see if somebody still has an illness or not, especially because some people don't have a proper antibody response. And that's part of how Lyme, Borrelia burgdorferi, and friends, other Borrelia species especially, trick the immune system. So sometimes they hide, or they reduce or suppress the ability to have those responses effectively. And you even see in really chronic people that sometimes their immunoglobulins or their antibodies will even go down. They'll go like more immune deficient even. So we turn to some of the T cell testing or the lymphocyte response testing too. The caveat to that is that sometimes that system isn't working very well either. But if you've established that in the beginning, that it is sort of working on some level, that you can see where the immune system is putting its attention to, you can use it after treatment, post-treatment, and see if they're still having a response or not. And the hope is that if they're not having a response, that they're clearing. So I think where I'm going personally, is a direct and indirect test to monitor, and probably using some combination of that culture and that T cell testing, probably literally doing both in my opinion, as an objective tool, and then really being clear on the patterns of their current presentation in a post-treatment world. And if they look more like dysautonomia, there could still be possible mast cell or other things too, or maybe there are connective tissue or structural issues within their system, to really try to differentiate that if possible. And maybe there's still some cleanup I need too. Maybe I need to treat EBV or something, who knows? Maybe there's a post-COVID layer. Maybe there's mitochondrial disorders. We'll talk about testing for that possibly too. So if I can really do that objectively, and then retake their case, like reevaluate them entirely, including physical examination ideally, I can get a much better idea if we're past the bugs or not.
Yeah. Well, so just to, you said a lot there.
Yes.
So just, so people, just to reiterate again, is that, so what we've always used is these antibody tests, and antibody tests mean that the bug has to create the signal, the antigen, and then your body has to make the antibody, and then we measure whether you're making a lot of antibodies to that bug. And so that's a complicated system that usually works pretty well. But in some people with Lyme, especially, the bug can kind of modulate that a little bit, or sometimes just really hide itself. And so you're not seeing, it's not making many antigens. So those antibody tests don't always work. And that's where we got the T cell tests, which is a different part of the immune system, and see if they're noticing the bug. And then the newest piece, which it says, is the culture, which is really exciting. Because if the culture is positive, you definitely had bug there. One of the great arguments has always been that antibody testing can show past infection. And at least with the culture, if it's positive, that's real. The argument with the T cell testing, they're supposed to go away within 3 to 6 months if they don't keep seeing this irritant, the bug. So these are, unfortunately, as Dr. Kunkle was explaining, each one of these tests can go awry. So we're still not in the perfect world. But if you put them together, we're getting a lot better.